What is systemic sclerosis? There are two main types of scleroderma: the localized non-systemic version, only affecting the skin and sometimes the underlying soft tissues, and the systemic version that may affect the internal organs in addition. Systemic sclerosis is also called systemic scleroderma, or only scleroderma, and is used interchangeably. The term scleroderma comes from the Greek word sclero, which means hard or hardening, and derma meaning skin. The term translates directly to hardening of the skin. Systemic sclerosis is an autoimmune, inflammatory and fibrotic connective tissue disease. The cause of the condition is unclear. It most notably affects the skin in all areas, but it also affects the internal organs. Systemic sclerosis is characterized by deposition of extracellular matrix, which results in thickening of the skin, and abnormalities of small blood vessels. The two forms are limited systemic sclerosis, which is sometimes called limited cutaneous sclerosis, and diffuse systemic sclerosis is also called diffuse cutaneous systemic sclerosis. We will use the terms limited systemic sclerosis and diffuse systemic sclerosis. Limited systemic sclerosis is, as the name says, the more limited version of systemic sclerosis. Usually the fingers and sometimes the face are affected by thickened skin. This is a milder form of the disease. Limited systemic sclerosis used to be called CREST syndrome. This forms a helpful mnemonic for remembering the features of limited systemic sclerosis. C for calcinosis, which is calcium deposits that build up under the skin. This is most commonly found on the fingertips. R for Raynaud's phenomenon, which is when the fingertips go completely white and then blue in response to even mild cold. It is caused by vasoconstriction of the vessels supplying the fingers. This commonly occurs without any associated systemic disease. However, it is a classic feature of systemic sclerosis. E for esophageal dysmotility, caused by connective tissue dysfunction in the esophagus. This is commonly associated with swallowing difficulties, acid reflux, and esophagitis. S for sclerodactyly, which describes the skin changes in the hands. As the skin tightens around joints, it restricts the range of motion in the joint and reduces the function of the joints. As the skin hardens and tightens further, the fat pads on the fingers are lost. The skin can break and ulcerate. T for telangiectasia, which is caused by dilated small blood vessels in the skin. They are tiny veins that have dilated. They have a fine thread-like appearance. The other form of systemic sclerosis is the diffuse systemic sclerosis, which is the more severe form and includes the features of CREST syndrome, plus affects many internal organs, causing cardiovascular problems, particularly hypertension and coronary artery disease, lung problems, particularly pulmonary hypertension and pulmonary fibrosis, and kidney problems, particularly glomerulonephritis, and a condition called scleroderma renal crisis. Autoantibodies can be an important support when diagnosing systemic sclerosis. There are many autoantibodies involved in systemic sclerosis, and they are helpful in predicting the extent of the disease and which organs will be affected. Anti-nuclear antibodies, ANA, are positive in most patients with systemic sclerosis. They are not specific to systemic sclerosis. Anti-centromere antibodies are mostly associated with limited cutaneous systemic sclerosis. Anti-SCL70 antibodies, also called anti-topoisomerase I, are mostly associated with diffuse cutaneous systemic sclerosis. They are associated with more severe disease. Anti-RNA polymerase III antibodies have a prognostic value. They are more frequent in patients with diffuse systemic sclerosis. Patients who have these antibodies show an increased risk for skin thickening, renal crisis, and malignancies, but do not show severe interstitial fibrosis. In 2013, a set of new classification criteria was published by the American College of Rheumatology and the European League Against Rheumatism Collaborative Initiative. The main criterion is skin thickening of the fingers of both hands, which is enough for being classified. If that is not present, 7 additional items apply, where the antibodies against centromere, SCL70 and RNA polymerase III are all included. If one or more of the antibodies are positive, then 3 points are given. If you have a total score of 9 or more, you are classified as having systemic sclerosis. It is important to stress that classification criteria are not designed for diagnosis or treatment decisions. They should never be used to exclude patients who do not fully meet these criteria from receiving appropriate therapies.